Well, good afternoon, everyone. We are the session, I guess, keeping you from lunch, but I promise this will be an appetizing conversation. We are going to be talking about design for health and what the principles are, what examples are, and then preparing us for our breakout this afternoon. As Catherine said, this is also being recorded as a segment of a Shot in the Arm podcast, which is a weekly podcast looking at global health and human rights. Yeah, that will be on an episode coming very, very shortly. So I'm delighted to introduce our panel. LaFond from JSI, Tracy Johnson from the Bill and Melinda Gates Foundation, and Jaspal Sandhu from the Gobee group. So welcome to the panel. So my first question, and Tracy, perhaps you can answer this. What is Design for Health? How would you summarize it for a lay audience?
So Design for Health is an initiative that was supported or is supported by the Bill and Melinda Gates Foundation along with USAID's Center for Innovation and Impact. And I should call out that there are three critical people who couldn't join us today. Dave Milestone, Nikki Tyler, and Amy Lynn, who has more recently joined this effort. It started about a little over 3 years ago as Dave and Nikki and I looked at the landscape of projects that were using human-centered design in global health and realized that we needed a mechanism to scale design in global health. How could it be better used? And so we set out to create this community to enhance understanding, appropriate use, and value of design not on its own, but as an approach to help the global health community achieve its goals. And so in essence, what that was convening implementing partners, design firms, other funders, complementary methodologies in the social sciences, for example, and bringing that group together to say, what are the challenges that we're facing, and how might we co-create a vision forward? One of the first things that we were tasked with doing, and we were a little bit surprised at this, is the community said, go back to the beginning. What are we doing here? What is design? And so we intentionally took a broad definition. We wanted to be inclusive. You've all heard the terms, design thinking, human-centered design, behavioral design, social design. What does it all mean? And so we wanted to say that design, in this context, is a systematic process that allows us to bring together different skill sets to analyze a problem in context. What is the context of that problem? And to pursue innovation by really putting the lived experience of people at the forefront.
So you could argue in very, very simplistic terms that Design for Health is giving us insights to the way we create products and services in the health field that actually have that are rooted in the experience of the communities that they are going to serve. Anne, do you want to talk a little bit about the work that JSI has done in the partnership and how the monitoring and evaluation components connect to this?
Sure. I think it's fair to say that design is not a heavily measured field, and global health is an overly measured field, right? So in the context of bringing these two communities together, we've thought about how do we use measurement in a way that helps explain the trajectory of what design is helping us accomplish in global health. How can we ground it in some kind of metrics that we already use? How can we bring in new ways of thinking about measurement in the design process? So it's as an evolving practice of design and health coming together, measurement is really critical in that space in thinking about holding ourselves accountable, but also explaining what is design actually intended to do? Is it reaching not just the goals of creating better solutions for better health, but also changing the process of how we go about working in the global health space? we've had the opportunity in JSI to be an evaluation partner for a number of different design activities. One I could give as an example was called CHN on the go, and CHN is a community health nurse. And it was a design-led mobile app program to try and help improve health worker motivation and job satisfaction amongst rural health workers. And the app was co-designed intimately with the supervisors and the nurses. And we used measurement not only to see if they were using the app, using metadata, but also to dive more deeply into their satisfaction with the app and continue to iterate on it. And then at the end to do an end-line evaluation to see was the engagement with the different modules helping them improve their job satisfaction. Did it meet those needs or address those pain points that were discovered during the design process? So we had a whole network of different kinds of measurement that were used. Some of it was more standard public health, and some of it was unique to really understanding the influence of design. And it's been quite critical in helping us decide if these interventions are working well, what we would do differently the next time, and what's the role that design is actually playing.
Jaspal, you've been an early thinker in the design for health field, and I guess you bridge those two gaps of the design field and have a background in medicine. What is it about design that appealed to you so much and that made you think that this is something that could be used to improve health services and products?
Good question, Ben. I think it's, design for those who come to it from the outside can sometimes seem like a shiny object or a little bit mysterious. But when people start to experience what design is actually like, it really taps into a lot of our common sense and our human values about how we actually do problem solving. So I think there's a natural and intuitive fit, and that's, when I started work in this space, it's been about 15 years ago, it wasn't as common for people to be talking about design in the space of global health. There were others, but I guess we're also at a very different time now. I think of, and I'm borrowing from your language, Tracy, or your life course metaphor perhaps, is that Design for Health, if it was in its infancy in the early 2000s, it's sort of going through that awkward middle school phase, early adolescence right now. And that's, it's a tough place to be, but it's a beautiful place to be. And I think it really speaks to why we needed to have this community of practice and why it was so important for the Gates Foundation and CII at USAID to bring all of us together. Because there's something I feel like I should say as one of the design members of the Design for Health community is it's kind of a weird thing, or it was, when we got these initial invites in 2017, because for these first 10, 12, 15 years in this field, all of us in the design space have been doing this work in partnership, not with other design firms, but with implementing partners and with funders. And any good designer is also going to have an individual or an organization the arrogance to think that they do it the best, right? And this ask was for us all to come together and together with our peer organizations, sometimes our competitors, to think about design differently, to say, we've come far enough, we've gotten through elementary school, let's look back now and see, looking forward, can we do things better? Can we work together in some ways, or can we at least learn from each other's lessons?
I mean, one example that comes to mind where I think Design for Health could be very impactful is in some of the future HIV prevention technologies that are being explored at the moment. So long-acting injectables, injections that will give you 6 months or 3 months of protection. But what we've discovered is that these injectables, there are a lot of fluid, so these are big injections, and are they intramuscular or how are they delivered? And I guess one of the questions that really comes to mind is that in the past we've thought about, right, let's explore medical innovation, and then once we've got it, let's think about how we get it to people. What we're doing here is thinking very differently about bringing the user experience right from the start. And I guess Tracy, that leads me back to you and to sort of ask the question, your founder, Bill Gates, husband of Melinda Gates, was one of the great pioneers of developing user experience through technology. Can you explain a little bit about the foundation's interest in Design for Health and what you're hoping to get out of this partnership?
Well, actually, before I answer that question, can I take a little bit of a step back to what you were talking about with HIV prevention technologies? And I think one of the critical things that we don't talk about design when we're thinking about the aesthetic function related to product design, for example, is its ability to reframe problems from a person's point of view. And so in the situation of HIV, one of the things that we've learned is even before we begin to talk about a prevention technology, for example, we have to understand how it is, let's just say, an adolescent girl in South Africa, when she thinks she's having sex and when she doesn't. And oftentimes when we've learned that there are cases where she may be having sexual behavior or engaging in sexual behavior, but because she's not initiating it, she doesn't see it as being sexually active. And so how do we even begin to talk to someone to even sort of bring in that product? I don't know if I necessarily want to speak for the foundation. It's a large place with many initiatives. What I can say is that it is probably over 5 years ago where there was a growing sense of we're putting things out into the world and maybe they're not achieving the uptake and hence the impact that we would like. And so what are some things that we can borrow from the private sector that will achieve greater uptake? And so human-centered design was one of those efforts. There were others as well. I think we've seen traction with it. I think we've seen the ability to reframe problems, but also design better products and services that one of the things we haven't measured as well is we know when we design something with people, like community health workers, the uptake is faster. They know we've designed it with their intuition, and so it's much easier for them to use and sustain use over time. And so we're continuing to sort of build on those early successes to see where we can take the community.
Thank you. And so that concept of learning from the private sector, I think, is really key. And so I'm just going to take an opportunity to make 2 shout-outs. We've had the first one already, and I'll reiterate it to the Bay Area Global Health Alliance and to Sarah Anderson, and to encourage people, if you haven't interacted locally with BACA, you really should. This is a fascinating place where the different sectors are coming together. And another shout out to another local group called Tech for HIV, and Marguerite Handley is in the audience there, which is really looking at learning from particularly the tech industry and how data is managed and how that can be used to respond more effectively to the HIV response. So Anne, a question for you. How do we use health data more effectively? What does the Design for Health initiative tell us about what information we're getting out, and then how we get it to people who need to know about it?
That's an interesting question. We have quite a bit of work looking at that challenge of enabling or facilitating or encouraging people to use data in the health sector. We're now I guess, blessed with an abundance of data that we didn't have at our fingertips before, but we are not necessarily equipping people to take that data and use it in a very easy way. And in fact, Jaspal and I collaborated in Ethiopia on a project that was all about improving data use and thinking about it, how to do that on a national scale. And we talk a lot about this idea of culture and the culture of data use and what's preventing that culture from from really taking off. And design has been used to help unpack those barriers, those pain points of what a health worker or a health manager or even a policymaker is experiencing, and thinking about not just how we package the data and visualize it, but how do we create a work environment or incentives in the workplace that actually reward people and encourage them for being good and systematic users of data. It's not a natural thing. People aren't trained to do that. But by engaging them and understanding framing the problem, as you said, from their vantage point, and in coming up with solutions, design helps us like move that needle forward faster.
Jaspal, make it real for you, for us. Get your fingers dirty. Give us an example of a design for health initiative, either that you've been involved in or that you've seen, that you think really captures the essence of where this movement is going.
That's a great question, a big question. I'm inclined to talk about, so we at Gobee, we do work globally and we do work domestically, and I really think across borders quite a lot. I have a pretty tangible example from some work that we did here in the US in the state of New Jersey, which is really related to this question you just asked Anne about how people use data and how information flows through systems. The challenge at hand, this is somewhere outside of Philadelphia, but in a pretty rural area. You've got a federally qualified health center system that's providing care to publicly insured and uninsured patients, including 25,000 women who they're doing breast cancer screening for each year. Because a number of them are seasonal and migrant farm workers from Mexico, there's a lot of migration and a lot of loss to follow up in the system. And a lot of the challenges that we saw in southern New Jersey are the same challenges that we've seen in places like Kenya. To Tracy's earlier point about framing, the organization that we worked with, Center for Care Innovations, and this Complete Care Health Network in southern New Jersey, at the beginning they wanted to set up a technology system for text reminders. The thought was these women aren't coming in because they either have forgotten their appointments or they just need that extra little nudge or encouragement to come in. And I'd love to say that it was a beautiful technology solution that came out of the other side. It wasn't. It was a complete overhaul of how they did communications with patients and how really they allayed fears that women had when they didn't hear back or they heard that something was wrong, but they couldn't get that information over the phone. So through a comprehensive kind of system overhaul, they were able to drastically improve their key measure. And so for the nerds that are in this space, there's a number of days between an abnormal result that you get when you're actually doing the screening and the follow-up that comes afterwards. And they took that, using the design process and the organization doing it, from 26 days to 15 days in just a few months. And to me, that sort of captures a lot of this. It captures the bit about data, it captures reframing, it captures how we think about technology, and it captures a little bit of measurement as well, and actually seeing when these innovations are actually translating into something that matters.
So at Devex this afternoon, there is going to be a breakout session about design for health, and both for the audience and indeed the listeners and viewers of a Shot in the Arm podcast, what would you say are the big takeaways that people should really work on and consider as we move this field forward? And Tracy, maybe I'll start with you.
Well, actually, one of the things that I spend a lot of time thinking about, and it's not necessarily, skills will be learned in the workshop that I think can drive toward this, but as we've built the community and sort of added onto it, it has been a very organic effort that people have brought their energy to. What we're realizing is that we need to actually start to bring in country governments in the countries where we work to be more a part of this effort, to understand design, what it can bring them, what a design process looks like, the time it takes, and so on. And so my hope is that we can, in the next iteration of bringing together this community, we can include those members. But at the same time, I think it does take us sitting down more and continuing to interrogate what is design, how are we doing it, how are we overcoming the challenges of bringing this very private sector-oriented effort into a very different space that has very different sort of timelines and sense of progression to actually get to scale, and how are we building on that?
So I realize that we've come to our time, and I do not want to stop people from getting their lunch. But there's a lot to unpack and discuss here, so thank you so much for your attention, and please join me in thanking our panelists, and good job for the rest of the afternoon.